Hi, I'm Dr. Jesse Scholes, physical therapist, Mukwonago, Wisconsin. Today I'm going to show you a program for strengthening the multifidi muscles of your lower back. Now, these are not power muscles. These are itty-bitty, small little muscles that live between each bone in your lower back, the lumbar vertebrae. If these muscles are not strong, they tend to clamp down and basically stay tight, which puts more pressure on the low back, but also sabotages how those joints function when you're doing basic things as much as heavy lifting things. So if these muscles don't function well, it can affect your walking and your running and your sitting and other things as well. So what I'm going to show you is kind of a bunch of different options for how to progress this. And as long as you abide by the general kind of rules for this, this should work pretty darn well. So what you're going to start with, and the one thing I really recommend that you have, is an exercise ball like the one I'm sitting on. This is a physio ball or a Swiss ball, or basically just one of those large exercise balls that is meant to be sat on or done exercises on. If for whatever reason you will not or cannot afford one of these balls, which should only be $35 at the most, then what I recommend is you use 2 or 3 pillows to lay over on your stomach on top of. It'll basically provide the same sort of thing for kind of allowing your body to move. However, the one additional benefit of this ball is that it is soft, which kind of gets your stomach muscles to probably engage a little bit better. So what we're going to do is basically go through a progression for how to kind of increase the load or tension on these muscles. And this is something that you should be able to do the highest level that I'm going to show you today. If you're just a normal person walking around, it's not like you have to go into a gym and watch somebody that's squatting or lifting a lot of weight overhead, like over 100 pounds. These are muscles that everybody has, and they should be functioning for you with everything you do. So the bar is set pretty high for even the average person as far as what they can do. So what you're going to do is make sure, no matter what phase of this exercise that you're doing, that your low back and your hips or your pelvis is not moving. That is absolutely crucial. Sometimes there's some other muscles that are too tight or problematic that you will not be able to do that, which in that case, like with anything else, you're going to have probably someone take a look at them. But if you've already been, cleared medically to do these should be very safe and smooth exercises to do. I'm primarily making this video for my patients that I haven't had time to go over this exercise with them in the clinic. So with that said, how you're going to start is over your ball or your pillows, and it does not matter what size ball in general you use. This is a 55 centimeter ball by Pro Series, and if you wanted to use a 45 centimeter ball, something that was probably 75 centimeters depending upon your height, that should be okay. But if you're a very short person and you have a 75 centimeter ball, that probably will be a little bit of a mismatch. So, keeping my low back still, I'm going to make sure I am breathing as I lift one leg up, hold for about 3 to 5 seconds, and let it down. As I'm doing this, you should hopefully notice I'm not moving my hips and I'm not moving my lower back. I am just moving my leg. That is it. If this is very challenging for you, you may have to downgrade this difficulty level a little bit even more by just starting with raising one arm out in front of you at a time. Again, holding for 3 to 5 seconds. Again, want to make sure that your low back and pelvis do not move. You always want to alternate arms or legs when you're doing this. If you do not, it's easy to think you're keeping everything still, but if you let your hip drop a little bit, like I just did during the first lift, you think you're doing really well as you keep lifting, and you don't notice you screwed up until after you shift back to the center to try the other leg. Now, once you can do quite a few of the alternating leg lifts, holding each side again for 3 to 5 seconds, what you can try is one notch up, which is lifting up the opposite arm and leg. You want to make sure, again, you keep your pelvis and low back perfectly still. You want to try to kind of lengthen the arm and leg that you're lifting up. Make sure your face is not looking up for any of these exercises. You want to keep it looking down towards the floor. Now, if you can do that exercise a number of times, the next level is going to be lifting up the same side arm and leg. And again, holding for 3 to 5 seconds each time when you do it. Now, lifting up the same side arm and leg and the opposite do slightly different things. So if you can lift up the same side arm and leg, I would personally recommend rotating through a series of lifting up the right arm and leg, then the left arm and leg, then the opposite, left arm, right leg, and then right arm and left leg. And then continue through that series, even though order does not really matter. Because now we're working everything in that low back area for basic daily function. Now, what if you can do that for 1 minute, maybe even 2 minutes? That's good. It's a good start. However, for most people, depending upon what you want to do during the day and how slouchy you are and or how bad you might have a low back problem, you might need to take it up a notch. So, you don't have to change the exercises, but what we do need to do is add a little extra tension. So how you can do that? Have a little hand weight in each hand and or an ankle weight on each leg. And gradually increase the resistance or how much weight you have on your arms and or your legs as you do this. But again, you must keep your low back and pelvis still. If you do have, we'll say arm weights or hand weights, but no leg weights, what you can do is get a resistance band, tie it around your knees, and do the same motion. The band will add a little bit of resistance as you lift your leg up. And if that is easy for you to do, and that's the only band that you have, instead of going to a higher level band, you can just move the band down to your ankles. It will provide more resistance and it'll be a little bit more challenging for you. And if you don't have hand weights, what you can do is just grab 2 small objects in the house. That weighs somewhere between 1 and 5 pounds, obviously working from 1 to 5 pounds. And basically just gradually increasing the resistance for that. But if you work yourself through this program, you should be able to increase your back strength, specifically in those little muscles that are so important, the multifidi and the lower back, fairly quickly. Now, what I'd recommend is at least 4, possibly 5 days per week doing this exercise. And I would recommend you doing 3 sets on the days that you do them. So a set is a group. So 3 groups of anywhere between 1 and 2 minutes. So we'll call it like a 6-minute back program. 6 minutes of your day, several days per week for a healthier, better, stronger back. And if you think when you first start off that seems like a undoable goal for you, just realize if you slowly progress yourself through this, there's no reason why your body generally shouldn't be able to do that, unless you have a very, very significant back problem. But the body's very resilient. Also, if you're wondering how good is good enough, there's really no limit. I've seen people do this exercise with a 5-pound weight on each leg, and I think it was probably about a 5-pound weight on each hand, and they will do that then for several minutes without rest. So with that said, the bar again here is pretty high for what these muscles can do for you if you ask them to work appropriately and you go through the progression. But here's to a stronger, healthier, happier back. Thanks for watching.